Hello, good morning, everyone. Welcome to the 34th Scientific Meeting Symposium 1, Drug Metabolism Research. I'm Chichita, a senior lecturer from Jeffrey Cha School of Medicine and Health Sciences and a member of Scientific Committee of the 34th MSPP Symposium. And this morning symposium, we have presentation by our honorable speaker, Professor Dr. Ong Chin Ang, a professor of pharmacology at the International Medical University, Malaysia. Please let me introduce a brief about Prof. Ong first. Professor Ong Chin Ang is an active researcher and pharmacist by profession. He graduated from the University of Science, Malaysia, Penang, with a Bachelor of Pharmacy honors degree and received his PhD from the Flinders University, Australia. He's currently the Professor of Pharmacology at the International Medical University, Malaysia. And before that, he was with us, the head of School of Pharmacy at the Monash University, Malaysia in 2016 to 2017. Since 1994, he has worked on cytochrome P450 enzymes with particular focus on their role in the drug metabolism, drug interaction, and pharmacogenetics. Prof. Ong's current research interests include the use of in vitro as well as in silico models to investigate the CYP-mediated interaction and genetic polymorphism. Up to date, he has published and presented over 100 scientific papers in the form of original research, review papers, and conference proceedings. He has supervised more than 20 research students. He is a member of Malaysian Pharmacist Society and International Society for the Study of Xenobiotics. He is currently the associate editor of the Clinical and Experimental Pharmacology and Physiology Journal and has been active reviewer of a number of international journals, including the Nature Scientific Reports, Xenobiotica, Chemical Biological Interactions, and Drug Metabolism and Disposition. In recognition of his achievements, Prof. Ong received Recognition Award of Excellence in Research from IMU and also the Pro Vice Chancellor Award of Excellence in Research from the Monash University, Malaysia. Today, we will have a great opportunity to learn Prof. Ong about his research entitled The Structure Function Analysis of Cytochrome P450 Enzymes, Kinetic and Computational Modeling for Drug Clearance Prediction. So I'm sure we all have benefits from his talk, and we have any questions, please indicate in the Q&A box for Prof. Ong to answer at the end. Without further ado, I would like to invite again and welcome Prof. Ong for his presentation. Prof. Ong, over to you.
Good morning, ladies and gentlemen. I'm glad to be here to present my topic, Structure Function Analysis of Cytochrome P450 Enzymes, Kinetic and Computational Modeling for Drug Clearance Prediction. In this presentation, I will first give you a brief introduction of cytochrome P450 enzymes and an important isoform, CYP2D6. This is followed by a presentation of our recent published works on important CYP2D6 alleles, allele 2, 10, 17, and 14. Let's first look at cytochrome P450 enzymes. Most drugs undergo phase 1 and phase 2 metabolism in human body. Among the phase 1 enzymes, different isoforms of CYP enzymes contribute to about 70% of drug biotransformation, indicating its important role in drug metabolism. CYP2D6, an important isoform, contributes to about 20 to 30% of metabolism of clinically used drugs. This slide lists the major substrate for CYP2D6, which include cardiovascular drugs such as beta blockers and CNS active drugs like antidepressants and antipsychotics. CYP2D6 is highly polymorphic with more than 100 allelic variants or alleles reported to date. Tramadol, a centrally acting opiate analgesic, is metabolized by CYP2D6 to M1, the main metabolite that contributes to the analgesic effect. Tramadol serum level is lower in extensive metabolizers than intermediate or poor metabolizers, those carrying CYP2D6 defective alleles, like those who are homozygous for defective allele 10, as shown here. Therefore, dose adjustment is often required to achieve desired analgesia with tramadol. Next, I will discuss our recent works on common CYP2D6 allele. The works have recently been published in Nonin-Smithberg's Archive of Pharmacology. In this study, we investigated allele 2, allele 10, and 17, which are the most common alleles in Caucasians, Asians, and Africans respectively, with allele frequency of 30 to 40% each. The X-ray crystal structure of CYP2D6 is shown on the right. As you can see here, CYP is a globular protein, consists of a relatively alpha helix-rich carboxy terminal half near the bottom, and relatively beta sheet-rich amino terminal half near the top. Located within the interior of the protein is the active site pocket, where the heme group, color pink here, is located. Allele 2 carries two mutations, R296C, where arginine is replaced by cysteine at residue 296, and another mutation, S486T. R296C is located on I helix near protein surface, and S486T is located on beta 4 sheet and is part of the substrate recognition site. In allele 10, we have a unique substitution, P34S, located at the N terminal, and also S486T. Allele 17 carries T107I, a unique substitution, in addition to R296C and S486T. T107I is located on B prime helix, which is close to the active site and is also part of the substrate access channel. This is a channel where CYP2D6 ligands make entry and egress into and out from the active site. The following methodologies were adopted in this study. Starting from the CYP2D6 ddNA, we introduced nucleotide changes corresponding to the reported amino acid substitution in allele using the quick change site-directed mutagenesis kit. Once the mutant cDNA were generated, they were expressed as recombinant protein in E. coli expression system. The expressed protein were examined for their activity using HPLC and fluorescence-based assays. Kinetic parameters were generated from these assays. On the other hand, we had also created in silico mutant model for the variant using the published CYP2D6 crystal structure from the protein data bank as a template. This was accomplished using a modeling software, the BioVia Discovery Studio program. Docking of the substrate and inhibitor probes used in the enzyme assay were carried out, where docking poses and binding energy values were determined. All the data from the enzyme assay and docking study were then compared and analyzed. All the data are compiled in a single table and organized as shown on this slide. We developed two enzyme assays using two substrate probes, venlafaxine and antidepressant, which is the major CYP2D6 substrate, and 3-cyano-7-ethoxycoumarin, CEC, a fluorogenic substrate that allow high throughput screening of the enzyme activity. From the assay, we determined Vmax, maximal velocity, Km, the Michaelis-Menten constant for each variant protein. We also determined the ratio of Vmax to Km that represents the intrinsic clearance value. Intrinsic clearance represents the inherent enzymatic activity of the protein, and is an important parameter to look at when examining enzyme activity in vitro studies. We also carry out inhibition studies in the two assays with four non-CYP2D6 inhibitors, quinidine, fluoxetine, paroxetine, and terbinafine, where IC50 values were determined. Lastly, the binding energy values from the docking study of venlafaxine, CEC, and the four inhibitors were also listed here for comparison purpose. Let us now zoom into the kinetic data from the two enzyme assays. Here, the kinetic data from venlafaxine and CEC assays are listed together with the docking data. This is the substrate saturation or Michaelis-Menten plot derived from venlafaxine assay. As you can see here, allele number 1 of wild-type protein show the highest Vmax value, followed by allele 2, allele 10, and lastly, allele 17. Km values and ratio of Vmax to Km were also determined and compared. Data from the previous slides are represented here as bar chart for ease of comparison. As can be seen clearly here, allele 2 did not show much difference or change in activity in comparison to the wild type. The activity of the allele 10 and 17 were, however, significantly reduced. The kinetic data are supported by the docking data, which show better binding for both venlafaxine and CEC for the wild type and allele 2, and lower binding for allele 10 and 17. Docking data of venlafaxine are displayed in the next slide. As you can see here, venlafaxine form more numbers of bonding with active site residue in the wild type and allele 2 than in allele 10 and 17, consistent with their binding energy values. Furthermore, venlafaxine bound closer to the heme in the wild type and allele 2, but it was positioned further from heme in allele 10 and 17. So the picture that emerges from the data suggests that the two substitution in allele 2, R296C and S486T did not adversely affect the enzyme activity. This is a different story for allele 10 and 17, which shows significant drop in activity, implying the detrimental effect of unique mutation P34S and T107I in this allele. P34S is located at the N-terminal. The substitution is believed to disrupt the important proline-rich sequence PPGP at the N-terminal. As the N-terminal is the membrane anchor region of the protein, the exchange here would disrupt the protein insertion into the membrane and adversely affect the protein folding of the surrounding regions, thus affecting the ligand binding and catalysis. The role of P34S is substantiated by a recent study by Fukuyoshi and colleagues. They carry out a molecular dynamic simulation, MD simulation, of allele 10 model and were able to show that P34S exchange had negatively affected the hydrogen bonding network in the interdomain region between N-terminal and FG loop, which is close to the active site and form parts of the substrate access channel, resulting in lower binding affinity for ligand and reduced catalytic activity. In the case of T107I, as indicated in the model we have generated here, the residue sits on top of the active site adjacent to the substrate access channel. Threonine 107 in the wild type has its alcoholic site change pointing towards the active site pocket, whereas isoleucine 107 in the allele 17 model on the right had its long hydrophobic site change pointing away from the active site. This different orientation is believed to have altered the hydrogen bonding pattern in the neighboring regions and hence affecting activity. The role of T107I is also supported by a study by Handa and colleagues. They carried out computational docking and MD simulation of allele 17 model and showed that T107I exchange had resulted in compromised ligand access and binding. Another structural feature we examine is the effect of mutation on substrate access channel. There are a few substrate access channel reported in CYP2D6 from various in silico modeling study. One important channel is channel 2B, which is displayed in red color on this slide. Channel 2B stretches from protein surface and reaches the active site, flanked by secondary structure that include beta 1 and beta 2 sheets and loop regions of F, G, B prime, F prime, as well as C helixes. To examine the change in the morphology of channel 2B, we measure the diameter of the entrance opening and middle portion of the channel 2B. As shown on the table here, the diameters were smaller in the mutant models as compared to the wild type. We also noted that the active site volume has decreased in the variant model, where decrease was larger in allele 10 and 17 compared to allele 2 and in the wild type. So our computational models were able to show the effect of mutation on the protein structure, where shrinkage in the active site pocket and narrowing of the substrate access channel have been observed. And these structural changes are believed to account for the reduced activity in the variant protein. We will now move to the inhibition study. The IC50 values of quinidine, fluoxetine, paroxetine, and terbinafine, together with the docking data, are highlighted and separately displayed on this slide. The inhibition data are further displayed as bar chart here. The blue bars represent IC50 values obtained from venlafaxine AC, whereas brown bars were those from the CEC AC. We can see here that CYP2D6 variant show inhibitor-specific inhibition pattern. Both enhanced and reduced inhibition were observed depending on the inhibitors investigated. Enhanced quinidine inhibition was observed for allele 2 and allele 17, but reduced inhibition was noted in allele 10. Fluoxetine generally show reduced inhibition in the variants as indicated by higher IC50 values. Paroxetine, on the other hand, show enhanced inhibition in variants, especially in allele 10 and 17. Last but not least, terbinafine shows similar inhibition in variant proteins, except for allele 2 that show enhanced inhibition. As a summary, our study has demonstrated that unique mutation in allele 10 and 17 tended to cause deleterious effect on ligand binding and catalysis. Substitution in allele 2 appear to cause minimal change in ligand, catalysis, and binding. Data here have provided some basis for prediction of drug clearance and drug interaction involving CYP2D6 allelic variants. Carriers of CYP2D6 allele 10 and 17 are likely to have reduced catalytic capability towards CYP2D6 substrate. They are also more likely to have increased risk of drug-drug interaction involving typical inhibitors and substrates. More recently, we have concluded another study investigating two rare but unique variants in Asian population, allele 14A and 14B. The data from this study has recently been submitted to Fundamental and Clinical Pharmacology Journal for consideration for publication. These variants carry a unique substitution G169R in addition to the common mutations as reported in other variants. Our data indicated that the mutation have caused significant reduction in enzyme activity and generally enhanced inhibition by CYP2D6 typical inhibitors. As a general summary, we have used in vitro and in silico approaches to investigate CYP structure-function relationship. Our studies show that unique mutation in common CYP2D6 allele have caused alteration in the morphology of the active site and substrate access channel, resulting in reduced catalytic activity to a substrate and alter inhibitor specificity. The data imply that the carriers of defective CYP2D6 allele will likely have reduced substrate disposition kinetics and are more prone to drug-drug interaction. CYP2D6 intermediate and poor metabolizer may thus require careful dosing of drug substrate inhibitor. Further studies, both in vivo and clinical trial, are warranted to further verify the finding from our study. Before I end, I would like to acknowledge the contribution of my collaborators to the works presented here. These are my co-workers from Monash, Malaysia, Nottingham, Malaysia, and also IMU. With that, I end my presentation today. Thank you.
Thank you, Prof. Ong, for a very important and informative talk. Now we will move on to the Q&A section. If you have any questions, please feel free to indicate in the Q&A box, or you may use the raise hand function and for Prof. Ong to answer the questions. while we are waiting for the audience, thank you very much again for highlighting the importance of CYP variants, especially the CYP2D6. And Prof. Ong, can you elaborate a little bit more about how our Malaysian population and Asia Pacific region populations has such different CYP varieties and any challenges and impact on the drug metabolism?
Okay, thank you, Dr. Chichita, for chairing the session and also for your kind introduction of me in the early part of the session. Okay, regarding CYP2D6 in the context of Malaysian and also population in the region. I think Asian population, they have different, I would say, different profile of the allelic variation in terms of CYP2D6. As I mentioned in my presentation, CYP2D6 allele 10 is actually more common in Asian population. And this allele can have a frequency as high as 30 to 40%. In fact, in say some Chinese population, allele frequency of 50% has been reported actually. So what does this imply is that because allele 10 is an allele with reduced activity, it's not a non-functioning allele actually. So meaning that the allele, even though we carry, we still have some ability to metabolize CYP2D6 substrate. So meaning that what this implies is that quite a substantial proportion of the Asian population will be classified as intermediate metabolizer, not poor metabolizer, and of course there are also some extensive metabolizer. So what does this imply is that as an intermediate metabolizer, they will be requiring some slight adjustment in the dose for drug substrate. But the adjustment won't be as drastic as say those poor metabolizer. So what I can say is that in terms of drug response, generally Asian population, including Malaysian, they actually in general respond well to CYP2D6 substrate, but because of the prevalence of intermediate metabolizer, it's likely that some will require slightly lower dose, but not the dose as low as those poor metabolizer to get the good drug response. So this is what I can say about the enzyme activity in the context of Asian population. Thank you.
Thank you very much. And we have, because of the time constraint, we will end the section, and we thank you once again, Prof. Ong, for your very valuable talk today. And we will join back at 10:15 to the main section. Thank you very much.
Thank you, everyone.
Prof.
Thank you, everyone.
And all the participants.
Yeah.
Thanks.